Ladies and gentlemen, members of the media. Ladies and gentlemen, our first COVID-19 patient remains in isolation at Lotoko Hospital, where he is in stable condition. On Thursday, the 19th of March, I advised the public of a sweeping set of containment measures that was put into place, including an aggressive contact tracing exercise to identify, isolate, and monitor any individuals who came into close contact with his first patient. As part of this exercise, we immediately identified and isolated 11 members of the first patient's household at our isolation ward in Nandi Hospital. These individuals were transported in a secure, hygienic medical vehicle directly to the isolation ward in Nandi Hospital. There was zero contact made with any person in Nandi or anywhere outside the Lotoka confined area. Once isolated, household members displaying symptoms were all tested for COVID-19. Within isolation, the patient's mother has since tested positive for COVID-19, making this the first locally transmitted case in the country. She remains in isolation at Nandi Hospital, where she is in stable condition. The patient's other household contacts, ranging in age from 1 to 57, also remain in isolation. The patient's mother was asymptomatic when first isolated at Nandi Hospital, meaning she was not displaying any symptoms at the time. She developed symptoms soon after entering isolation at Nandi Hospital. This is a good thing, as it greatly reduces the likelihood she had transmitted the virus before isolation. Regardless, we are widening our contact tracing to identify anyone who she was in contact with within 24 hours prior to being isolated. These individuals will be quarantined and monitored as well. While the patient's mother is currently isolated at Nandi Hospital, it is clear she contracted the virus while in the Lotoka confined area. As I've already made clear, she was securely and hygienically transported to Nandi Hospital, so she poses no risk to the public in Nandi. Therefore, we will not be widening the boundaries of the Lotoka confined area for the time being. Once again, the Lotoka confined area is defined as the area spanning from the Queens Road at Matawalu Junction to the Feeder Road at Wakamburi Junction to the Queens Road at Natalau Junction. Ladies and gentlemen, this first locally transmitted case reinforces the need for the current confinement measures to remain in place. We have learned lessons from other countries that did not heed to the strongest possible containment measures early. Fiji will not make those same mistakes. Whether you are a local or a foreign national, if in Lotoka confined area, you will need to stay within the confined area. It does not matter if you're from Mars. For at least the next 12 days, you will be required to stay in the Lotoka confined area. That is what will be required, that is what decisive action demands. Similarly, we even stopped foreign nationals who may have been in direct contact with our first COVID-19 positive patient from boarding any flights, given that they could pose a threat to other travelers and members of our airport staff and flight crews. Instead, they must remain in Fiji under strict self-quarantine for the 14-day period, after which they will be allowed to return home. We've received a number of requests from individuals seeking exceptions to our strict confinement protocols. I want to tell you all that there will be no exceptions be made, not when we're dealing with the issue of life or death. I'm here with the Commissioner of Police, who will answer any questions you may have about what is and what isn't allowed in the Lotoka confined area. While the borders of the confinement area remain closed, banks, supermarkets, pharmacies, and other essential industries have already announced including but not limited to the civil service, FNPF, Voreqe, and roading services, will remain open. We are also safely transporting produce to the markets so that residents can access the vital services they need. Nationwide, gatherings of 20 or more people are not allowed. Gyms, fitness centers, swimming pools, and nightclubs will remain closed everywhere in Fiji. Recreation contact sporting engagements are also banned. Nationwide, the 2-week school holiday period has been moved up to begin this Monday, the 23rd of March. We may very well extend the school holiday depending on how this situation develops. Last night, as you will have heard, our national carrier, Fiji Airways, announced the most stringent scale back in the airlines industry, suspending 95% of its international flights. Our travel restrictions remain in full effect. All Fijians and foreign nationals entering the country are required to self-quarantine for 14 days upon arrival to Fiji. Of course, with the vast majority of international flights suspended and the flow of passengers virtually halted, we are not expecting to see many people arriving at our shores for some time. As Dr. Elisha has also explained on a number of occasions, self-quarantine measures mean individuals are required to stay in their homes or another confined space for 14 days. If they develop any symptoms, they should immediately contact the Minister of Health and Medical Services. While at home, these individuals should avoid in-person contact with as much as possible. Ladies and gentlemen, this second case is a sobering reminder that COVID-19 is extremely contagious, and young people, while more likely to recover, can transmit the virus to more vulnerable members of our society. The need for diligence among all Fijians of all ages is critical to containment. Wash your hands with soap and water for at least 20 seconds. Because remember, every time you touch things around you, you could potentially spread the virus. And you may be spreading it to a loved one on whose age, immune system or underlying health conditions make them less resilient than you. If you do cough or sneeze, do it in your elbow or tissue and maintain a safe distance of 2 meters between yourself and others as much as possible. It is also vital, and I cannot stress this enough, that everyone in Fiji tells the truth to authorities, border agents, and medical staff at our hospitals. If you lie about where you've been, the symptoms you've been feeling, or when your symptoms started, you could put your life and the lives of others in jeopardy, and you will be prosecuted to the fullest extent of the law. We need to work together to contain this virus, and your total honesty and commitment are vital in this fight. Our contact tracing efforts to both patients will continue. As we know, the first patient was the flight attendant. We are contacting, quarantining, and monitoring individuals present in Fiji who may have had contact with the patient, including on flights he serviced and in social settings prior to his isolation. So far, all COVID-19 tests we have conducted on other patients through our contact tracing have come back negative. As I've already announced, ladies and gentlemen, we are opening fever clinics throughout the country. These clinics will employ well-trained staff who practice strict procedures to keep people with fevers away from vulnerable people who visit health centers, separating them into dedicated spaces specially designed to effectively identify possible COVID-19 cases. The Ministry of Health and Medical Services is holding daily press briefings and putting out materials in the newspapers and on social media in all 3 languages, explaining exactly how the Fijian people can do their part in supporting our nationwide response effort. I'm going to say this again because it's so important. Wash your hands as often as possible. Every time you see a sink, wash your hands. Use soap and water. Scrub for 20 seconds. Tell your friends, tell your family members, and help us build a culture of cleanliness to stop this virus dead in its tracks. Fiji's health relies on your help in our containment efforts. If you have traveled overseas and feel unwell, immediately contact the Health Ministry on one of these numbers. In the Central Division, call 2219905. In the Eastern Division, call 2219906. In the Western Division, call 2219907. And in the Northern Division, call 2219908. I'd like to thank outstanding interpreters for helping keep all members of the public well informed of what we're doing, and our ordinary Fijians can enlist in our nationwide response effort. Well done, ladies.